All right, so today we're going to go over the cardiac cycle to get us started. And then we're going to get into heart attacks. And hopefully we can get into some risk factors for heart attacks, prevention of heart attacks, and how doctors can actually try to fix the conditions that lead to a heart attack, namely implanting a stent, which is technology that will blow your mind, and a coronary bypass. So you'll have to learn what coronary arteries are. But let's first get to this one. This is going to be the 4 phases of the cardiac cycle. You need to definitely remember what systolic and diastolic are. Systolic is going to be contraction, systolic is contraction, diastolic is relaxation. Now, the names of these phases or these 4 stages are blatantly obvious. Like you can interpret everything that's happening just by looking at the name. And they're going to help guide you and clue you in as to everything that's going on during this part. Number 1, ventricular filling. Obviously, by the name, what chambers are getting blood? Okay, well, so let's just start from here. Try to answer my questions. This will help you out with your test coming up next week. See what you know. In order for blood to enter the ventricles, what chambers must they be in first? So we have the blood enters the heart via atria. Now, in order for blood to go into the ventricles, would you expect the atria to relax or contract? That's right. So the atria contract. What does the contracting of the atria do? 2 things. When it contracts, what valves must be open for blood to move on to the next stage? What are the 2 AV valves? Tricuspid and bicuspid. The AV valves open. Okay, now, guys, cause and effect. The atria are contracting, the valves are opening. Where is blood going to go? Good. Atria pump blood to the ventricles. So blood is now filling up in the ventricles. Because the atria are contracted and the ventricles are just receiving blood, what do you suppose the state is of the ventricles? Are they contracted or relaxed? They are relaxed. Ventricles are relaxed. And they're receiving blood. Because the ventricles are relaxed and the ventricles are filling with blood, what valves must be closed in order for those ventricles to fill up with blood? The semilunar valves must be closed. What are the 2 semilunar valves? And pulmonary. Good. That's about it. One last thing I would like to ask you, because the atria are contracting, what word would we use for that? Systolic or systole. And because the atria are relaxed, what word would we use for that? Diastole. And that's all for step 1. So blood is just entering the heart, it's in the atria, and then it's getting pumped into the ventricles. That's it. Okay, step 2. Isovolumetric contraction. Guys, there's a method of lifting weights where you're not lifting and relaxing, lifting and relaxing. Like when Sebastian goes to the gym, he does this. Look at me. He's like this with a dumbbell. Being all big and swole, right, Sebastian? Instead, you could do this. Look at me. This is called isometrics. You take a plate, like a weighted plate or a book. I've done this in my AP class. You hold it out in your hand. You just stay there. And your muscles are just screaming. They're on fire because they're having to contract to keep your arm out. And so when I have students do this in class, they start out fine, but then their arm gets really weak from all that lactic acid buildup. And it's more lactic acid gets kind of your muscles going. This isovolumetric contraction is an in-between stage. There's nothing really happening here. Just like when I'm holding my arm out like this, I'm doing isometrics. In isovolumetric contraction, this is in between phases. This is in between the lub and the dub. So when you've heard me say lub dub, lub dub, lub dub, lub dub, this is in between, like that split second, the very, very, very split second. I don't even want to say moment, just flash of lub dub right in the middle. During this stage, atria are relaxed. So how would you describe their current state? They're diastolic. We're going to say diastole. And also because they are relaxed, what valves are now closed? AV valves are closed. You need to know that whenever a chamber is contracted, its valves are open. And of its valves are the valves that are at the end of the chamber, not at the beginning. So the atria's valves are the AV valves. The ventricle's valves are the semilunar valves. A valve is what actually allows the chamber to empty. So the atria are relaxed, the AV valves are closed. The ventricles begin to contract. And I want to key in on the word begin to. They're not fully contracted yet, but they begin to contract. What would you describe the state of the ventricles beginning? Systolic. Or systole, systolic, same thing. And because the ventricles are beginning to contract, what valves are beginning to open? Semilunar valves are opening. So this is a split second. It's in between the lub and the dub. Okay, step 3. These next two are really quick. Ventricular ejection. What's happening? Sebastian, what do you think is happening based on that title?
The blood is leaving the ventricles.
I will use those exact words. So Sebastian, because the ventricles are seeing the blood leave them, are the ventricles contracting or relaxing? So are they systolic or diastolic? Correct. Kate, can you tell me the two places that blood would go to after the heart pumps blood out of the ventricles? Okay. Is that what if blood? What side would blood have to be on if they're going to the lungs? Left or right?
Right.
And where's the left side lead to? The whole body. Okay, your approximate blood pressure at this stage is 120 millimeters of mercury. What is that millimeters of mercury? It's pressure. It's the unit of measurement for pressure. What ventricle has to be more powerful? The right one that goes to your lungs or the left one that pumps blood to your body? Yeah, it's definitely your left. Definitely your left. Your lungs are right here. You don't need a lot of force to get them next door, but you do need a lot of force to get blood all the way down your tippy toes and all the way back to your heart. So your left ventricle generates a lot more pressure. Okay, fourth and final stage. We have isovolumetric relaxation. The ventricles relax. So what are they beginning to transition to? Lance? Uh-huh. And because the ventricles are relaxing, what valves are closed? Semilunar. Once again, you guys need to learn that a valve is, or a chamber's valve is defined as the valve that allows the chamber to empty. What chamber does the tricuspid empty? Okay, I've heard atrium and I've heard ventricle. Listen to my words. What valve allows the atria to empty? Not empty into, empty itself. Is it a ventricle or is it an atrium? An atrium. Does blood empty from ventricle to atrium or does it empty from atrium to ventricle? So again, listen, what valve allows the left atrium to empty and have no more blood? Bicuspid. What valve allows the left ventricle to empty? I heard a lot of stuff right there. What valve allows the left ventricle to empty? The aortic valve. What valve allows the left, or excuse me, the right atrium to empty? I heard different answers. You got to get it straight, Kate. What valve allows the right atrium to empty? You spoke before you thought. Tricuspid. What valve allows the right ventricle to empty? What valve allows the right atrium to empty? Akita, you kind of. That's wrong. Right atrium?
Is it aortic?
Right atrium?
Is it?
Now you're just guessing. Do I have an image of the heart somewhere? Okay, here it is. Okay, guys, here's the right atrium. What valve allows the right atrium to empty? What valve allows the left ventricle to empty? You're speaking before you're thinking, Sebastian. What valve allows the left atrium to empty? What valve allows the right ventricle to empty? You got to get those straight. When I say a chamber's valve, it's the valve that allows it to empty. So let's continue this real quick. When the atria are contracting, what is happening to their valves? Okay, they are opening. So what are the valves that belong to the atria? AV valves, bicuspid and tricuspid. When the ventricles are contracting, what is happening to their valves? Okay, they're opening. What are the valves that belong to the ventricles? Semilunar valves. What are the semilunar valves? And in general, what happens to any valve when its chamber is relaxed? They're closed. Let me change my terms here a moment. What happens to the valves when the atria are in systole? Mackenzie? They're open because what does systole mean? Contract. What happens to the valves when what happens to their valves when the atria are diastole? What happens to the ventricles valves when the ventricles are in systole? What happens to the ventricles valves when the ventricles are in diastole? You got to know those. Okay, let's go on back. So now that's pretty much it. I'm going to pause the video because I want to show another video here that doesn't really show up well. So I'm going to pause this. All right, let's transition now to heart attacks. But before we get to heart attacks, you need to learn the 3 layers of the heart. Because one of these layers is the primary layer affected during a heart attack. Your outer layer is called the epicardium. The middle layer is called the myocardium. Now think back to last unit. Do you recall what the prefix myo means? It doesn't mean middle. That's meso. What is it? Very good, Amara. This means muscle. Guys, this layer is most affected by heart attacks. Because this is where your muscle is. And what happens to muscle when it doesn't get oxygen? It dies, just like anything else. So it's kind of a trick question. The same thing that happens to anything else in your body, it dies. And then lastly, what is the inner layer? It is called the endocardium. What we're going to mainly focus on is the myocardium. I'll show you a picture of a cross section of the heart, and it shows the 3 layers of tissue. You're going to see that the middle layer is the thickest. So let me show you that. There it is. Okay, here's the layers of the heart. You got the epi, the myo, and the endo. Myo does not mean middle. Meso means middle. Myo means muscle. Look how thick that layer is. That's the layer that is most affected by the heart. If you were actually to eat a heart like back in early human days, one way that they would show that they dominated their kill is that they would eat the heart. That would be a really chewy layer to get through, that myocardium. A lot of countries still do that, especially in Western Europe and Asia. They'll eat the heart of the animal. Okay, so now that you know that, we now need to get to what a coronary artery is. So I'm going to try to draw a poor man's heart here. I'm not the best at it. You don't need to necessarily draw this. I just wanted you to know what they are. Coronary arteries. So take a little breather. I'm going to try to draw this heart. Okay, you have these blood vessels that are on the surface of the heart. They all originate from your aorta. And just like every other part of your body, your heart muscle needs oxygen too. The inside of your heart is the pump, but the surface, especially the middle layer, the myocardium, it needs blood. These blood vessels are called coronary arteries. And you also have coronary veins that return it to your heart. But these blood vessels deliver O2, which is oxygen, to heart tissue. So what happens if a coronary artery is blocked for some reason? Will your heart tissue receive oxygen? And what will happen to that heart tissue if it's not receiving oxygen? it will begin to die. It will become necrotic. That's exactly what a heart attack is. A heart attack is where your heart tissue is not getting oxygen. What is another word for a brain attack when your brain's not getting oxygen? That's a stroke. That's the same idea. You have a clot or some sort of blockage preventing oxygen getting to your brain. A brain attack is a stroke. So now that you know that, let's get into what an actual heart attack is, how it can be treated, what are the risk factors, what causes it, and how to avoid it. We'll try to get all that today. We'll see how it goes. Okay, a heart attack. A heart attack is typically caused by acute coronary syndrome, or ACS. This basically means coronary arteries get blocked. If the coronary arteries are blocked, let's just do cause and effect. What happens to heart muscle? They no longer receive what? They no longer receive oxygen. And what happens to that heart muscle when it no longer receives oxygen? It begins to die. You can feel this with pain and tightness in your chest. It can be excruciating. Like, it cripples you. There are some there's a silent heart attack where it's a spasm. And it's not a blockage. It's just that your blood vessel is squeezing. But another term for you all to know is an infarction. I think I wasn't alive. My grandfather died, but I think he died of a myocardial infarction. Myocardial means that his myocardium was cut off of oxygen. An infarction is going to be an obstruction. An obstruction of blood supply to an organ or region of tissue. It causes death in that tissue. So let's say here's a coronary artery. And over here, this is a really horrible representation, but it's going to have to do. This is your myocardium, your muscle layer of your heart. This is a coronary artery. Let's say that my grandfather, for example, had a blood clot, and it was right here. There's the blood clot. Can blood get past that spot? No. So what happens to all the myocardium for the blood that's supposed to be going from left to right? Is it getting oxygen? No, it isn't. And so this would be called a myocardial infarction. This is a blockage of blood that supplies the myocardium. This is a heart attack. Now, the technology that doctors and hospitals have to treat this is incredible. It is really, really remarkable. And I hope to get that to you guys. It's only 3:10. We have about 16 minutes, so I should be able to get to it. I would like to show you what a nice, healthy coronary artery should look like versus one that is not so healthy. So here's a nice and healthy coronary artery. So you have good blood flow passing through, no obstructions, no decrease in volume, no high blood pressure. Everything is going great. And then here is a coronary artery that has atherosclerosis. We're going to call this an atherosclerotic coronary artery. I believe that we did this yesterday, right? Atherosclerosis. It sounds like you have a lisp when you say it, like atherosclerosis. It's where you have a buildup of plaque inside your blood vessel. Now, plaque is a general term used for like foreign debris. When the dentist is scraping plaque off your gums and your teeth, that's foreign debris. It builds up on your teeth. This plaque is not made of that same stuff. It's a general term. But this plaque comes from mainly your diet. It's cholesterol. And what it does is it builds up along the sides of your blood vessels, and it can really reduce the flow of blood. So if you look at that, this blood vessel is very, very restricted. That is atherosclerosis. You need to know that term. If this gets thick enough, it could actually cut off the blood supply to the area of your heart. And then that area of your heart dies. Now, before I show you a video to start to finish up class, I want to show you or introduce you to the risk factors for this. Unfortunately, in this country, do you know what the #1 killer of Americans is? It's not guns, it's not vapes, it's not smoking, it's not car accidents, it's not cancer. Heart disease. Quite honestly, we have some really bad food in this country. It's really bad for you. We are the country of saturated fat and salt. And those two things are brutal for your heart. Now, I can enjoy a burger as much as the next person. You can have a steak, it's okay. But guys, too much water will kill you. Too much of anything will kill you. So just remember for the rest of your lives, moderation, moderation. Sebastian, one day you're going to be bigger than John Cena and Arnold Schwarzenegger combined. You're going to be taking so many protein shakes, it will knock your socks off. But you know what happens when you drink too much protein shakes? You can't stop pooping. You just can't stop. Do you want to have eternal diarrhea? Moderation. Don't have too much protein, okay? And you're going to have really smelly farts. And your wife will hate you for it. So moderation. Here are the risk factors. Low density lipoprotein, abbreviated LDL. This is bad cholesterol. There's good cholesterol and there's bad cholesterol. Have you ever heard that avocados have good fat? That's true. That's HDL, high density lipoprotein. HDL actually clears your blood vessels out of the bad stuff. It's like a drain cleaner almost. LDL is that yellow stuff I drew in the blood vessel. That's bad fat. That's cholesterol. That's the bad stuff. That's from greasy foods. Next is hypertension, high blood pressure. Obesity. Sedentary lifestyle. Anyone know what that means? Yeah, you're pretty lazy. You come home, you ride the couch, you go to bed, you wake up, you go to work, you come home, you ride the couch, it's no exercise at all. Smoking. You know, my dad's dad died of heart conditions. My dad has a heart condition. He smoked his whole life. And eventually his cardiologist said, here's your safe word, heart attack. Maybe that'll get you to stop smoking. Every time you light up, I want you to hear my voice say heart attack. That's what his doctor said. And I think it's worked because he's really cut down. Advanced age. When you get older, your blood vessels just get weaker. Your heart gets weaker. A lot of seniors die of heart attacks and diabetes. Those are risk factors. Now, how do you prevent? You guys are 15, 16, 17, 18 years old. Right? I don't have to worry about heart attack, and I don't have to worry about this and that. Some of you, anybody have a heart condition in their family? I do. I certainly hope that you plan on getting to your 30s. You guys will be in your 40s one day. You will be in your 50s one day. You will be in your 60s one day. You got to make sure you live these, you try to practice these healthy lifestyles if you want to have a long, healthy life. Yes, Alex. You would eventually get cancer of some sort. I remember my anatomy professor in college told me that if men were bulletproof, we were immune to everything. Every man would eventually get prostate cancer. It's just part of the age. That's something that happens. So if you do all this and you live to be like 100, we're biological organic creatures. We don't last forever. But do you want to last longer? You only get one life. Spend about 150 minutes a week exercising. That's 2.5 hours. Not even 2.5 hours. Yeah, it is 2.5 hours. Walk your dog for like half hour a day for 5 days. You've got your workout. I'm not asking you to run a 10K up a mountain. Walk your dog on Bayshore. Heart healthy diet. Fruits, veggies, proteins, especially fish. Fish is really good for you. If you don't like fish, take some fish oil supplements. Beans, nuts, olive oil. Avoid red meat because of all the saturated fat. Processed foods. If you go to Publix, what do you think is healthier? Going to the deli and getting the sliced meat from behind the deli desk, or going to the like that shelf where they just have the packaged lunch meat? Yeah, the packaged lunch meat has a lot of preservatives, nitrates, other things that are just chemically treated. It's not that great. Processed foods and added sugars. A couple of weeks ago, I went to Disney World, and yeah, I don't live at school. I tell you guys that you can text me with a problem that you might have with something. I could be at Epcot and I could respond. Don't send me a Canvas message. Well, anyway, we got there and I was just tired. It was like, a long week at school. Woke up first thing in the morning, go to Epcot. Like, I need to pick me up. I was going to go to Red Bull. And at their desk, I asked, do they have sugar-free or do they have regular? The sugar-free had about 2% of the sugar you need in an entire day. The regular had 120%. That little tiny Red Bull can, not the big cans, the little can had 100%, and then another 20 of all the sugar a grown human needs in one day. That's the kind of stuff that kills your heart, is way too much sugar. And sodium. Stop smoking. Now, I'll repeat myself that we don't know the effects of vaping on the body yet. We do know that it causes chemical pneumonia. We don't know what it does to the heart yet. Do you want to be the guinea pig? Get 7 to 9 hours of sleep a day. I know, I wish. And then reduce your stress. See, you guys will learn eventually. You're going to take a stand. You're going to say, am I going to let the world control my life, or am I going to control my life? Am I going to let the world do it, or am I going to do it? You'll eventually, I hope that you all figure it out, but you need to eventually learn how you can control your stress. Inner peace, Guz Fraba. Okay, I'm going to stop the video here shortly, but before I do, for those of you watching at home, if you could do me a favor, go to YouTube and type in heart attack simulation video. I want you to find this video. And when you're done with that, go to YouTube and type in stent coronary artery. We're going to watch these videos now, and this will be